course.
We're starting at 8. Really? Roughly 8.
Hopefully.
You mean 8:30?
Oh, hopefully.
Hopefully 8:30.
Yeah.
But you said 8 o'clock.
Yeah, well, we'll put 8 o'clock so the listening people is going to come at 8:30 at least. You know?
So what time are we going to start?
We start, you and me start 8 and the course probably is going to start at 8:30.
Or 9?
Or 9.
Requests, we're going to look at the position of the hamstring and so where it is and what we're going to do with it. We've already done page 1, so as our preparation, and we've checked out as we're doing page 1 with our holding point up on the ischial tuberosity, we're able to check out which side of the hamstring is more tense underneath our palpation. We've also asked our client to say which side is tighter for you, and we've had a little look in terms of the straight leg raise test to find out which is the tighter side, the less flexible side. Sometimes it can be too flexible as well, but that's another subject. So let's have a little look down in here. So what we're going to do is we're going to work with our elbow into the long head of the biceps femoris, conjoined tendon of biceps femoris and semitendinosus, where it comes up to the ischial tuberosity. Now the hamstring doesn't stop here, but it carries on into the sacrotuberous ligament onto the sacrum. This is what we find in our dissective process. I want to use my elbow in here in order to get a fairly strong move, but also not just the strength of the move, but I want to make sure that I'm not being invasive or slipping in between his legs, and so the elbow is going to make much more sense to use. But what I have to do is I have to switch this off. So if he contracts that, so tighten this up for me, Willie, tighten. Yeah, so if he tightens this up as I lift the leg up, it means that if I'm putting my elbow into here, this could really, really hurt, so I don't want to do that. So therefore, I'm going to straighten the leg, and as I straighten the leg, this muscle is now switched off. It's the only reason I straighten the leg is to switch this muscle off, so I can work in here with my elbow and without hurting him. So in this position, my elbow can then take the skin tissue up towards the glute. I can then lean onto the lateral aspect, the outside aspect of the long head of biceps femoris, and I can make my move from here. When I'm making the move at the back of the knee, can you all see the back of the knee there? Again, it's between the tendons, so the thumb is coming between the tendons, exactly the same as move number 6 on page 1. So it's between these biceps femoris and semitendinosus and membranosus tendons in pretty much the same position. We don't have to worry about the angle of the leg for this. The jar is the big important thing. We want to make sure that the jar is onto the metatarsal pad. We don't want to be striking the sole or the heel. It's going to really hurt and damage somebody potentially. So we want to make sure that the jar is onto the metatarsal pad and is not restricted. So if we keep the hand square into this position, when we make the jar, we're going to be able to feel that the whole thing is going to come together. If I cross my hands over and do the jar with this hand, then the potential is for this wrist to block this movement. When we turn over, we can do the rest of the moves down the inside of the back of the leg. We call that our bears, but most of the work is being done when we do the jar. So the 80%, 75-80% of the work is done with this jar. So let's get this right. The key here is not to put too much pressure on. You don't need to be piling in with the elbow and forcing your way across. Again, remember, if you're hurting somebody, you're doing it wrong. It doesn't need to hurt to get the effects, to get the results. In fact, sometimes the opposite is true. They don't hardly need to feel anything at all. So hopefully that's useful for you. Please subscribe. Please click on. Anybody that watches my channel knows that I talk nonsense. So please click on like, subscribe, and send me any requests for anything else that you've got. Thank you.